Have you noticed a soft lump under your skin and wondered, is this dangerous? Could it be cancer? Do I need surgery? Not every lump is the same. 3 of the most common skin and soft tissue lumps are lipomas, sebaceous or epidermoid cysts, and dermoid cysts. They may look similar from the outside, but clinically they are very different. In this video, we'll compare how each lump feels, where they usually appear, warning signs to watch for, diagnosis, treatment differences, and when surgery becomes necessary. A lipoma is a benign tumor made of fat cells. It is the most common soft tissue tumor in adults. Lipomas are usually soft, rubbery, painless, and slow-growing. They move easily under the skin and are commonly found on the shoulders, back, neck, and upper arms. Most occur in adults between 40 and 60 years old. Patients often describe them as feeling like a soft, doughy ball beneath the skin. The good news is that lipomas are usually harmless and rarely become cancerous. However, doctors become concerned if a lump grows rapidly, becomes painful, feels hard, or becomes fixed to deeper tissues. In such cases, imaging like ultrasound or MRI may be needed to rule out a more serious condition called liposarcoma. Now let's talk about sebaceous cysts, which are more accurately called epidermoid cysts. These cysts form when skin cells become trapped beneath the skin surface. Inside the cyst, keratin accumulates, creating a thick, cheesy, and often foul-smelling material. Epidermoid cysts are usually round, firm, and located just beneath the skin. They often have a tiny central opening called a punctum. Common locations include the scalp, face, neck, and upper back. Unlike lipomas, these cysts are more attached to the skin itself. One major difference is that epidermoid cysts commonly become inflamed or infected. When infected, they may become red, swollen, painful, warm, and may even discharge pus. Many people mistake an infected cyst for a boil. A very important surgical point is that simply draining the cyst is not enough. If the cyst wall remains behind, the cyst usually comes back. Definitive treatment requires complete surgical removal of the entire cyst wall. Next are dermoid cysts. These are developmental cysts that are usually present from birth. They occur when skin and skin structures become trapped during embryonic development. Unlike epidermoid cysts, dermoid cysts may contain hair follicles, sebaceous glands, sweat glands, fat, and even hair. They are commonly found around the outer eyebrow, scalp, midline neck, and ovaries. In children, a painless lump near the outer eyebrow strongly suggests a dermoid cyst. These cysts are usually smooth, slow-growing, painless, and somewhat firmer than lipomas. An important surgical nuance is that some dermoid cysts, especially those near the midline of the face or scalp, may extend deeper toward the skull. Because of this, CT scan or MRI may sometimes be required before surgery. Treatment is usually complete surgical removal. So, how do doctors clinically differentiate these 3 lumps? Lipomas are soft, doughy, freely mobile, usually painless, and rarely infected. Epidermoid or sebaceous cysts are firmer, attached to the skin, often have a central punctum, may discharge foul-smelling material, and commonly become inflamed or infected. Dermoid cysts are congenital, often located near the eyebrow or midline structures, firmer than lipomas, and may contain hair or gland tissue. In many cases, a physical examination is enough to make the diagnosis. However, imaging may be needed if the lump is deep, rapidly enlarging, painful, fixed, or if the diagnosis is uncertain. Treatment also differs between these conditions. Most lipomas do not require treatment unless they become painful, enlarge significantly, cause cosmetic concerns, or interfere with movement. Treatment is usually simple surgical excision, often performed under local anesthesia in an outpatient setting. For epidermoid cysts, infected cysts may require antibiotics and sometimes incision and drainage. However, the definitive treatment is complete excision of the cyst wall after the inflammation settles. Removing an actively inflamed cyst increases the chance of recurrence. Dermoid cysts are usually surgically removed because they slowly enlarge, may rupture, and occasionally become infected. Surgeons try to remove them carefully without rupture. Depending on the location, surgery may be performed by pediatric surgeons, ENT surgeons, plastic surgeons, or ophthalmic surgeons. Finally, there are some red flags that should never be ignored. Seek medical evaluation urgently if a lump grows rapidly, becomes hard, causes persistent pain, ulcerates, bleeds, becomes fixed to deeper tissues, or causes neurological symptoms. Although most lumps are benign, soft tissue sarcomas can occasionally present as painless masses, so early evaluation is important. To summarize, a soft and mobile lump usually suggests a lipoma. A skin-attached lump with a punctum points more toward an epidermoid cyst, and a congenital lump near the eyebrow may suggest a dermoid cyst. Understanding these differences helps patients seek the right treatment early. If you found this video helpful, like the video, subscribe to the channel, and share it with someone worried about a skin lump. Stay informed and stay healthy.